Hi guys, welcome back to my channel. As you can tell from the title of this video, I am doing my surgery must-haves video. And I've done a video kind of like this, but this time I'm going to show you, and I'm going to show you all the things I have, and going to kind of explain like why I have them. And some of these things are like a definite, like you need all of these things. But some of them are also just my personal preference, so if you're having foot surgery, I'm not saying go and get all of these things, I'm just saying what makes my life a little bit easier. So, while I catch my breath, I'm going to go ahead and show you guys the first, like, must-have, like, medical stuff, and I'll show you my personal preference stuff after. So, the first thing that you need for foot surgery, when you show up to the hospital, they will ask you if you have this thing, and that is, if I can get to it, your crutches. So I have this pair of crutches with these little like pee pads on the hand grips and the like armpit part for saving my armpit. Anyways, I feel like I can't talk. Like, I'm doing a freaking terrible job already, and I just, like, opened my mouth. But I guess I tried to record this video once already, and I didn't even hit the record button, so that's my own damn fault. But anyways, crutches, must have. They ask you at the hospital, do you have your crutches? Yes, I do. You show them to them. They put a sticker with your name and birthday and all that stuff on the crutches. So they're yours. They put them under your bed, and they go with you everywhere. They won't let you leave the hospital unless you have them, because how are you going to get into your house? So, yeah, they'll either make you buy them or something, or, you know, you can talk to them and be like, yes, I have them at my house, I just didn't bring them with. But anyways, those are my personal pair. I bought them, like, last year, and I've used them for the past 4 surgeries that I've had, so, yes. Also, with me, another thing they ask you when you get to the hospital, do you have this? Yes, I do have a walking boot. This, I probably won't bring to the hospital this time because I already know for a 100% fact that I am crutching out of the hospital. I will not be walking. So I know I'm already going to be in a splint, so I probably won't bring this, unless they tell me that I have to, and then, in other words, I will. But this walking boot was one that was issued to me from my doctor, so this is mine. I own it. I don't have to give it back. So this one I've had for the past 2 or 3 surgeries, I believe. It's my 3rd one, so I obviously use them. But this one in particular, super ugly moon boot, but it has this air pump. Oh gosh, excuse me. Has this air pump so I can pump like air into it, and it'll like fit to my foot and my ankle and be super comfortable. Well, I mean, as comfortable as it can be, I guess. It's not really that comfortable. But the only downside is because of the air pump part, we can't like take it apart and wash it because it's all, lined with this tubing. So that kind of sucks. It smells really awful. But hey, I use it when I'm supposed to. The next thing that I think you, like, have to have is, well, first, ACE wrap. The hospital supplies ACE wrap. Like, they'll give you one when they wrap your foot up, because after surgery, they will make a hard cast for the bottom of your foot, and then, like, up the back of your calf, I guess. So they will make a hard cast and then put gauze around your foot where the stitches are, obviously, and then they will wrap the rest of it up with an ACE wrap. So they will give you 1 or 2 that is already wrapped around your foot, but I like to have extra just because one time, after surgery, my foot bled so bad it bled through the ACE wrap, through the gauze, through everything. We had to cut all of the gauze off and replace it with clean, sterile stuff at home. Like, it was on a Saturday, we couldn't go in. My doctor said, take it off right now, wash your hands, get this stuff, and thank God we had extra, or we would have been, like, shit out of luck. But we also have, pre-wrap, just in case. I mean, I never know. Sometimes I get super uncomfortable, like, pains underneath my heel, and so sometimes I just like to wrap it with some pre-wrap, and it tends to help. And then also athletic tape. and it has like hair all over it. So nasty. But athletic tape is a must for me because since I'm going to have stitches in my foot for 2 weeks, I'm not allowed to wash it for that 2 weeks. So I put a trash bag over my foot and I tape it up with athletic tape so that no water gets through. And I've tried packing tape, I've tried masking tape, I've tried duct tape, I've tried, all of those. But athletic tape works the best, and it doesn't hurt as much when you have to rip it off your leg. And after 2 weeks, your leg gets pretty hairy because you can't shave it, so athletic tape is very helpful. And also, if your gauze won't stay on, athletic tape is really good to keep it on. And then I have some more pre-wrap in here, but I have a whole bag of just medical elastic gauze bandages, I guess. They're these little like wraps of just gauze. So these come in handy. Like I said, the one time that my foot bled through all of my my whole wrap, it was really nice to have these extras because I would have been like screwed if I didn't have all of this stuff. So I'm really happy that we have been able to stock up. Excuse me, my alarm's going off. That was really loud. I'm sorry. But another thing with that are these Band-Aid brand medium gauze pads. These come in handy, just again, like I said, for when my foot bleeds like crazy amounts. And after 2 weeks, my dressings, the sterile dressing has never been like fully intact. It always will start to come apart, and so my doctor says, try to avoid unwrapping it if you can, but we're kind of professionals at this time. Nothing bad has happened, so these are good to have for when I need to rewrap my foot because it just gets so uncomfortable. So I like to have extra gauze pads just to be safe. And also, if anybody has ever had any sort of surgery, mostly like foot, I guess. I don't know. I haven't really had any other surgeries in my mouth, but, well, I guess I had to ice it. Anyways, I recommend these reusable gel ice packs, and it's been out of the freezer for a while, so I'm getting, like, ice that's falling off of it. But I recommend these 110%. These reusable little gel ones have been my saving grace. They have worked so well. My doctor tells me, holy cow, it's like snowing. But anyways, my doctor tells me to ice 30 minutes on, 30 minutes off for the first 48 hours. Overnight, he says it's not that big of a deal, but if I'm up, I should put ice on my foot for at least 30 minutes. So I do, and I have like 5 of these. I recommend to have at least 3, and here's why. I'm getting sick, I'm sorry. I recommend at least 3 of these because sometimes I use 2 of these at one time. This is a smaller one, so I would use 2. I put one like around my ankle area and one on the top of my foot just so it gets like covered in ice like it's supposed to be. So I'll use 2, and then I still have one extra in the freezer for next time, which is a bigger one, so it would cover the whole area. So I wouldn't need to use 2, but I would just have multiple of these because, again, since this one has been out for like 30 minutes, it's already not as cold as it was when I first pulled it out of the freezer. So putting it back in the freezer, it would take a while to freeze back up. So having extra just means, you don't have to be putting on a half-frozen ice pack, and it would actually do its job if it's completely frozen. So those must have more than one. The next thing also is, if I can get my hair off of me, is ibuprofen. I swear by this stuff. I take it all the time. Again, for swelling, it helps a lot. For pain, it helps a lot. When you're trying to wean off your pain medication, ibuprofen helps a lot. I would go back and forth between ibuprofen and Tylenol after the first week after my surgery so that I could get off of my hard pain medication so that I could drive again and do normal things, get out of my bed and spend time with family and stuff like that. So ibuprofen is a must. And also my prescription drugs. I do have my prescription medication. I'm not going to show them just because I'll just show the ibuprofen. But I was prescribed a narcotic for pain and also a medication for my anxiety before I go into the hospital. So that should help a lot. Also, this is my last thing for like doctor like must have. And this probably looks really freaking strange, but this is like a little pad. It goes on the bottom of my foot, and in this case it would be the bottom of my left foot since I'm having surgery on my right. I don't have any circulation or fat in either of my feet, and when I say that, I am not exaggerating. Under the ball of my foot, it literally is my bone, a little bit of skin, and then I hit the hard floor. So I have socks on 100% of the time. I cannot just walk on hardwood floor comfortably because I have no cushion there. So this is where this pad comes in handy, and since all of my weight is going to be on my left foot, I slip this pad on. My big toe goes through a special little hole. I'm just going to put it on my hand just because. But under the ball of my foot, there's a big circle rubber pad, I guess, that gives a lot more cushion than my foot can give. So this pad comes in handy. I probably won't wear it all the time, but a lot of the time I will have this on just because it saves my foot, and my foot is in a lot of pain with the bone, without the cushion the way it is, so this helps a lot. It is weird, but it helps a lot. And now the next thing, like, I guess it's kind of like your doctor would recommend it, but it's also my personal preference, so I'll put it into my personal preferences, because that's where we're starting. So with me, so being on crutches, I don't have a lot of balance on one foot. I'm pretty terrible at it, but by now, I mean, I've gotten the hang of it. I'm not a pro, but I'm getting there. So I like to have really good tennis shoes, and these in this case are Nike. They don't have to be Nike, but again, these are just the ones that I have. I like these tennis shoes. They're super light, very breathable, just really awesome. They fit to my foot really well. And this is my right shoe. Obviously, I won't be using my right shoe, but having a tennis shoe on my good foot for balance is pretty good. Also, crutching with flip-flops is probably not your best idea, so tennis shoes would probably work. I also have a pair of Snooks that are behind me that I won't show, but those are also, they cover my whole foot, and I might wear those as well, but as of right now, tennis shoes are my go-to, so I will be wearing these to the hospital. Either these or I have this pair of Nikes as well. They're just gray and pink. These ones are heavier than these ones are, so I don't know which ones I will pick yet, but again, probably one of these two is what I will be wearing to the hospital, and a majority of the time after I am on crutches. So with my shoes, you obviously need socks. So I have just a few pairs here, because I have 4 pair. There are 4 different kinds, and I will explain each kind. So one, I have these super fuzzy, obnoxious socks. Let me see if I can get them out. But they're huge, fuzzy. The elastic is basically broken, so they just, fit. I like to have these because my feet get really cold really quickly. I don't have any insulation, cushion, circulation, whatever in my feet, so these fuzzy socks keep my feet warm. Also, my toes stick out of my splint after I have surgery, and so these socks stretch out pretty far so they can just go right over the top and cover my toes, so my toes don't get freezing. So these I recommend. And I hate fuzzy socks on any normal occasion, but after surgery, I will wear these. So, also, I have these pair of just, really cheap, dollar socks. They're just these purple ones I've had for a while, but again, they stretch really far, so I can put them over my splint. And I don't care if they get blood on them or anything, I can just toss them and it wouldn't be a big loss. So those, these socks they're another, cheap brand. I think they're, Walmart brand, but they are thicker socks. So this is, mostly for my good foot that I'll be able to use. Not as much for my splint, but they are cushioned at the bottom, so that helps with, the padding on the bottom of my foot. And they are super warm because, again, my feet get really cold. So these are super helpful. And then these next ones are more on like the pricey side, but I just ordered them because I've been wanting them for a really long time. So I got a pair of Nike socks. They don't go super high up, but they cover my ankle. They have like padding for my ankle, padding for the heel, and padding for the ball of my foot, which is again what I was looking for, and they're taller, so they are really comfortable, super warm, and just I think they were worth it. I got a pack of 3 of these, 2 white and black and 1 gray and black for $15 online, so that was really nice. But I will probably wear these the most, not on my splint, just on my good foot, because I don't really want these to get blood or anything on them, but I will definitely still use them. And then again, for sleeping and I guess more like the clothing part, like the socks, I have a few different like clothing items. Don't mind me, I'm gonna like reach and grab them. But first I have these pair of capri sweatpants that have little pockets and they tie. They are super loose fitting, super breathable, thin. They're not like super heavy sweatpants. The bottom where my foot goes through is super stretchy, so it will easily fit over my splint, because again I can't unwrap my splint and put stuff on, so I won't be able to wear leggings and like skinny jeans and stuff like that. It'll mostly be sweatpants for me, like for the first couple weeks. So capris that are loose fitting and super stretchy for the win. Also, I have these little shorts that I got from Kohl's. They're a cute pattern. They're super thin. They're like the cooling material. I don't know like what it's called, but so they're super thin because I get super hot and sweaty when I'm just laying in my bed all day. For some reason, I don't know, it's weird, but I think it's the anesthesia and the pain medication that I'm on, so shorts are kind of a must, and it's going to be May, so it's a little bit warmer. Next is just a cheap t-shirt that I don't care about sweating in, so this like t-shirt's like 5 years old, short sleeve, cheap, thin, breathable, nice. So again, I don't sweat to death, and I live through my surgery. The next thing, this is kind of more a comfort item than anything. This is like my all-time favorite blanket. My dad got this for me at Kohl's, but it's like a Sherpa throw. One side is the Sherpa, the other side is just gray, soft, like plain material. Like I don't know what the material is, but it's not like fuzzy or anything. Super soft. I sleep with this blanket like every night just because I love it. But when I have surgery, I will most likely sleep with a throw blanket instead of my giant comforter because, again, I sweat to death. Every night I sweat. So, throw blanket, super nice to have. And I will probably bring this to the hospital to help ease, like, most of my anxiety from going in there. And, yeah, so this is super nice to have. Also, next, is a pillow. And not even one pillow. I recommend like 1,000 pillows. It's just in my opinion. This is just one of the many pillows that I will be using. This is like my main like sleeping pillow. Love it. So soft, comfortable. But I have a body pillow. I have 4 of these pillows. So that's already at 5. And then I have 3 throw pillows. So this is why I recommend like so many pillows. 1, I am not the type of person that can just sleep flat on my back. I wake up in the night and I'm on my side, on my stomach, not on my back. But when you have surgery, I have to keep my foot elevated for like the first 2 weeks until my stitches come out. So I sleep with it elevated, I sit with it elevated, I just have it elevated at all times. So I need at least like 3 pillows to keep it elevated, and that's where the 3 throw pillows come in handy. And then the 5 extra pillows come in handy with me being comfortable. So since I'll be on my back, I like to kind of make like a triangle type thing, and I lay in the middle, and I have pillows like going on both sides of me so that I can kind of like cuddle up to either side, and it feels like I'm sleeping on my side, but I'm not. Like it's just how I get super comfortable. So that's why I recommend like a shit ton of pillows. Excuse my French, but it's necessary. Now, also, in the middle of the night, I will be taking pain medication, and I also am on a antibiotic after my surgery. I will be on an antibiotic, so with both of those medications, if I don't take it with food, I will get sick. So we went to Costco yesterday and we picked up these Nature Valley dark chocolate and peanut butter protein bars. So these will be so good to have in the middle of the night. My mom comes and wakes me up and gives me my medicine because I'm so drugged that I don't wake up to my alarms. So my mom will come in and bring me a snack and bring me my medicine, and then help me get comfortable again so that I can go back to sleep. And this isn't the whole time that I have surgery. It's only the first couple of days that my mom will come and help me because I'm so doped up that I can't do anything for myself. So these protein bars will be super nice. I can just grab one and eat it in my bed and it won't make a giant mess, and it's not like my mom has to slave over the stove and cook me like a steak or something as I'm waiting in bed. And then also at Costco, we got these Kirkland organic applesauce pouches. These again will be really easy for me to just grab and go in the middle of the night. They're not like the cup applesauces that I will spill all over myself, because it has happened before, which is really embarrassing, but again, I was drugged, so it really wasn't my fault. But, so the applesauce pouches will be a lot easier than the applesauce cups. I don't need to get a spoon, I don't have to get anything, I just open the pouch and eat my applesauce, and it's good. So those will work really easily in the middle of the night. Now I have this here water bottle. I recommend one of these for several reasons. One, they're super nice to have in the middle of the night, just, for any reason. I wake up with super dry mouth because of my pain medication, so I'm constantly drinking water. Also, I have a water by my bed so that I can take that pain medication. So yeah, you kind of need to take that with some water. And also, it has this loop on the lid so that I can carry it while I crutch around, because I can't hold a glass of water and crutch around. I can actually. I learned that I can do that. I can figure it out after the 6th time, but it is a lot easier when you have a little loop and then something that can screw all the way shut so that you don't spill water all over the place, because that has happened while I was teaching myself how to crutch around with the glass of water. I dropped the glass on the floor, and I was home alone, so I had to figure out how to clean that up. So that was pretty terrible, but I'm just going to save myself the stress and just get a water bottle that closes all the way that I can carry around with me. I'm super out of breath and I want to die right now, but almost done. I have 2 more things. So these are the last 2 things that are on my personal preference list. Laying in my bed, I get so bored. So freaking bored. I can sit on my phone and scroll through Facebook for only so long, so I sit and I will either color. So right here I have this Disney Animals coloring book. I don't know, I love Disney, so this is perfect. But here, this is what the pages look like. So this is Scar from Lion King, if you don't know. But they're adult coloring pages, so it's not just a Dumbo and you sit and color it like a 4-year-old coloring book. This is adult coloring book, and it's a stress reliever, and it's a good distraction, and it's not boring. So that is I live by. And then my other thing is I have this book right here. This is the Indigo Spell. It's a Bloodlines novel. It's book number 3. I have, oh my Lanta, I need some water. Okay, anyways, this is a spin-off series to the Vampire Academy books. I don't know if anybody reads them or even reads anymore, but I'm on book number 3. I read the 6 Vampire Academy books in 2 months, so I blew through those. And so I am almost done with this book, and I have books 4, 5, and 6 to read as well, but this is just the one that I grabbed to show. So I have a book also to read so that I don't get super bored scrolling through Facebook. But, yeah, so that is basically it for this video. I hope it's not super long, and I hope it's not super rushed also. I'm sorry, my throat is super dry, and I feel like just coughing up my lungs right about now, but I will refrain from doing that. But anyways, yeah, thank you guys so much for watching, and I will see you guys on Friday for my surgery video.